This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning on a beautiful day. It's always a beautiful day to get healthy, and that's what we're here for, to try to help you out in that regard. We call it Health Watch, and you'll find us here every Sunday, 8 till 9 on Talk Radio 1210, WPHT. As always, Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And what we discuss here on the show is everything and anything related to innovative medicine and how it can help you and your family improve your overall quality of life. We call that our mission statement, which we bring you at the top of every show. And as always, if you have a medical challenge or a question for Dr. Molly, 855-839-1210, 855-839-1210. That is our number here in the studio anytime during the course of the show. If you want to jump in with a question or a medical challenge to run by Dr. Molly, that's what you do, 855-839-1210. Always a good day to get healthy, Dr.
Great,
Molly,
John.
right?
It's a beautiful day out. We should all be out walking around and enjoying life.
All right, talk about innovative medical, and we always have this segment because people, no matter what, come into your facility for the consultation, and they have listened to the show.
Sure.
And they say, well, Dr. Molly, I mean, how does this work? I mean, what is it you do?
Yeah. Well, first of all, Integrative Medical Associates is actually a cooperation between healthcare providers who all work out of my primary care facility. And what that means is we can do anything any other primary care facility can do. If you need a blood pressure medication, we can give it to you. If you need an antibiotic, we can give it to you. But we like to go one step further. We believe that we'd like to limit the use of pharmaceuticals and use natural products, God's ingredients, as much as we can so that we can reduce the side effects of the pharmaceuticals.
In the case of the nutraceuticals and the natural products, does that sometimes take the place of prescription meds?
It can, but many times what it does is it can augment a prescription med so that you can use a lower dose for a less period of time and not suffer the side effects from it and still get the results, the medical results that my medical directors are looking for. So, you have to choose, though, your natural products very, very carefully.
And it's interesting, we always talk about your nurse, Barbara.
Oh, she knows a lot.
The other day I'm sitting in the chair, and she's going over the list with a patient of what she recommends. And the patient had a bag, and Barbara's carrying the bag, and she said, look, here's what you do. So she was explaining what you get as opposed to maybe what you had, which may not be any good.
Right.
And that has happened often, right?
Listen, how many times do I say people go into the health food store? Now we have all these pharmacies that are now health food store experts, right?
Yes.
Okay, you go in, they put you in the direction of a particular aisle and say, oh, that's where your problem is. Pick up that, pick up this. Well, I think there's a little more to it.
The cornerstone of your practice is the hydration therapies.
Yes.
So talk about that, what they are and how it's different for every patient.
Well, one of the reasons why, first of all, hydration is a great modality because it can deliver the natural products we want in a dosing that's appropriate for the patient, enough that you get to the therapeutic level of that particular product. It's the constituents in that product that we really are looking for. There's usually a constituent in a particular product that actually effectuates the change. And that's where our mind is always going. At least that's where my mind's always going.
And how much does it take to effectuate change?
Well, you got to have a therapeutic level, the same thing that you would with an antibiotic. When the doc gives you a Z-Pack, he wants you to start with the 2 tablets the first day and continue the whole pack. because
it
you
always-
have
it
to
always
reach
says, yeah.
right. You have to reach a therapeutic level. So how do we know where the therapeutic level is? Well, we have an estimate as to where the therapeutic level is depending on how we use the nutraceutical. Are we using it in conjunction with a Z-Pack? Are we using it in conjunction with your blood pressure medication? We will slowly get you up to the therapeutic value.
And how many treatments does it take to get to that level?
Well, you know, John, that's a great question because, again, the physiology of each human being is a little different. We know the general physiology, okay? We know that if you have hardening of the arteries, you have some cholesterol buildup. We know it's going to take approximately 30 treatments, but you'll start to see treatment in 5 weeks. You'll start to see a decrease in your blood pressure if we're doing it correctly, and we do.
You have delivered results quickly in a lot of cases.
Probably within 5 weeks if people do it the way we ask.
And how does that happen? How does
Because we reach the therapeutic level. We are very, very good at figuring out how many. I mean, there's a matrix for everything I do. I think I said this last week when a gentleman called to try to trick me up about intercellular,
I know.
magnesium. But the point is, there's a matrix to everything we do. And the thing is, I believe in the Goldilocks theory. Just right. Not too much, not too little. That's just right. And just right for you is different than for me. And what we do is we take into consideration your history, your physical that we do when you come in, and your checklist, and what vitamins and minerals you're taking already. So these are the things we look at when we put a protocol together for you.
You know, it's interesting. I was talking to another patient a couple weeks ago, and he said, well, how long you been coming? I said, 20 years. He said, well, you got me beat by one. I'm 19. And I guess the question always becomes, people say, well, you keep going. Why? So maybe you can answer that.
Well, I'll tell you why. You want to keep your reserve up. That's the thing. But you don't come at the frequency you do when you first start. Look, let's take cancer, for example. You met my patient. She's with us how long, John? 15 years.
Yes.
15 years. Okay, when she first started, she was in 3 to 4 days a week, Judy. And what happened is, gradually we brought her back to a place of homeostasis where everything is where it should be. And now she comes in once every month. However, sometimes when she's feeling a little bit more fatigue, when she's had an extremely stressful period of time, she may come in twice that month.
So it depends on the situation
challenge,
and the person.
And the person and where they're at. So I don't want people to think they have to go steady with us. Look, did you go on vacation for a couple of weeks?
Yes.
Right. I mean, the whole idea of what we do is to improve your quality of life. If you have pain, it's to hold down the pain. So the bottom line is this. You will make some decisions along with the medical professionals and the healthcare providers in my office and myself. We'll sit down and say, hey, listen, why don't you cut down now to once a month? You know how many times I've told people they can come back once a month and they say, you know what, Molly, I'm coming in twice a month because I really feel good.
And that's a good thing.
It's absolutely, but it's not because I'm roping them in. You know, in the old days they used to rag you in for a suit. Now it's not like that. We really want to listen to our patient, and if our patient has a regression of any kind, obviously I want them in a little more often.
And I know you're very astute at checking with the patients, checking their charts. You're always checking.
Right.
I mean, you hardly ever sleep.
No, I sleep, but that's what makes this a medical hydration clinic.
As opposed to
a spa-like kind of thing.
I saw, actually, there's a billboard in South Jersey, and there's two doctors, and it says, come in for your spa treatment.
Right.
And there's two doctors, and Botox and all that stuff.
Yeah, right.
So
and I'm not against any of that.
That's not what you do, though.
No, that isn't what we do. I'm very clear on that. People generally come to me. Well, let me rephrase that for a minute. Generally, they come to me with a condition. However, lately I've been seeing more and more younger people who are coming to me because they possibly thought they had COVID and they just don't want their immune system to go down. So we see that. And again, it's because I'm not just throwing vitamin C at you. That's the other thing, John. People think, oh, well, I'm going to go in for a vitamin drip. Okay, that's all right.
That's part of it, right?
Right on. There are many things that constitute a particular bag in our facility, but it co-depends on what the patient is looking to accomplish, what condition or what drove them into us, and where they want to end up. It's as simple as that.
Patients come in and say, Dr. Molly, give me some of that vitamin C. That's not how it works, right?
Yeah, no, but it's okay. But it's not what, let me put it this way. We put together an entire medical facility because we really want to effectuate change for patients, because we think that functional medicine is what counts. It isn't your diagnosis. It's how you're functioning through this diagnosis. And that's really what separates us from a lot of people.
All right, we're coming up on our first break of the morning. Our show is called Health Watch. You'll find us here every Sunday, 8 till 9 on Talk Radio 1210. WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. 855-839-1210 is our number here. And we always tell you, you want to call in, you have a medical challenge or you have a question for Dr. Molly, early is the best time to call because Dr. Molly will have plenty of time to go over your situation and answer your question. 855-839-1210 with Dr. Molly Fantasia. I'm John DeMasi, coming back with more Health Watch after these words. And we're back here on Health Watch. Operators are standing by, as they always are when we're here on the air, at Innovative Medical Associates, of course. The number is 856-489-0505, 856-489-0505. You have a question, you want to make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and that's where you really can get a lot of your information as far as, if you want to move forward with the decision to do more with Dr. Molly. That's what you do. You schedule that initial consultation. Again, 856-489-0505 is the number. 856-489-0505. The website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210, WPHT. Dr. Molly, you talked about this last week a little bit, but I know you wanted to really elaborate today on the lymphatic system.
I do, John, I do.
And you're eventually going to tell us why it's important.
Right.
So,
yeah, I mean, listen, if this is interesting because you see me walk through the clinic.
Yes.
What do I talk about a lot of times? I say, oh, you know what? You need a little lymphatic drain today.
Yes.
You hear me say
I've
that.
heard you say that.
You've heard me say it. I'd say, Linda, put this next bag together. Here, I have a recipe for a lymphatic drain. Why is that so important? It's particularly important in cancer. It's particularly important in autoimmune. It's particularly important for viruses. It's important for bacterial toxins. So the lymphatic system is as important as our circulatory system. So we know that the circulatory system has a pump, right?
Yes.
It's the heart, right?
Right.
Do we know that? Everybody
Yes.
knows that. But you see, the lymphatic system, I always talk about it being somewhat of a closed system. But I guess a more appropriate way to talk about it is it has no pump. So it is a system that works on its own. It doesn't drain. It doesn't have a pump. So manual stimulation is a good way to boost that. So people have done things like lymphatic massage. You'll hear women talk about it when they've had mastectomies, right? Because why? What happens is scar tissue builds up, and you'll see that what happens is then blocks the lymphatic system, and many times women, you'll see them come into our facility and they'll have some elastic bandage around that arm where they remove the breast. That's why, because the lymphatic fluid isn't draining. So the lymphatic system has three primary functions. It battles pathogens, it removes cellular waste, which means the waste that is coming out of every day, morning till to the day you die, from the day you're born, your cells are always working, right? They call that the Krebs cycle. I don't want to get into that, guys, because that's a big course, okay, in organic chemistry. But it's always putting out that cellular waste, and it's the lymphatics that actually carry that out and filter it and bring it back to the system clean and pure. The other thing, it absorbs critical nutrients. It's really important for us when we give you the hydration. It's also, this is interesting, it helps maintain your fluid balance. So it is very appropriate to use hydration to utilize and move your lymph system. It's not many places do what we do. And we do have an actual organic and homeopathic as well as nutraceutical involved lymphatic drain. And you'll see me use it a lot for the cancer patients, a lot. So here's the thing. It's mostly overlooked in many modern day medical facilities. People trust that it's always working pretty well. Well, that may not be true. Do you remember having your tonsils out, John?
You know what? I never did.
Well, that's good. Your mother was smart.
My mother and father didn't believe in it.
They were so smart because why? The adenoid, spleen, thymus, and tonsils are all part of that lymphatic drain system. So guess what? It has a purpose. You know, they say, take the tonsils out. It didn't mean anything. 40 years ago, 50 years ago, that was true. Today, physicians are much more in tune with the fact that those particular organs, those particular systems have a place. For example, if you're in a car accident or have a trauma, they take out your spleen. Well, let me tell you, that's not innocuous. If you have your spleen out, we've really got to realize that's part of the lymphatic system that has been damaged. So here's the thing. You know that the lymphatic system is its own immune sort of army. The lymphatic system actually helps improve your body's ability to fight off infections, to fight off some of the things that cause these autoimmune problems like viruses, fungus, bacteria. So you know what? You need help in identifying the pathogens, and it's the lymphatics that start the army moving of your white blood cells that do the work.
So if the lymphatic system is not functioning properly,
right,
does that mean your immune system is not functioning properly?
You bet.
So
it's
this
your
is the connection.
You know what this is, John? This is the first line of defense. It's like all the troops on the perimeter work through the lymphatic system. Isn't that interesting?
That's a very interesting way to put it.
Yeah, because it's true. It's the biological alarm that sounds off. If, do you know that when you go in, your doctor will feel around your throat, right?
Yes.
He's feeling for what? Your lymph glands,
right?
Well,
yes.
if they're swollen, do you think you have a problem?
Yes,
You're
I would say.
darn right.
Yes.
And that's the place that most people come in to see me. Oh, I had swollen adenoids. I had swollen this. Guess what? You already have the infection then. The idea is you want to fine-tune this lymph process so that you stay away from having the swelling. Does that make sense?
Yes, it makes sense. Talk about scleroderma, which you mentioned last week.
Oh, well.
And what does this have to do with?
Well, I was going to get to the scleroderma, but I got a call this week from a potential patient. Very nice people, and actually they came in to see one of my medical directors in another setting. And he said, you need to think about whatever else you can do for your wife because, there's not a lot out there for scleroderma. And scleroderma is an autoimmune. Most people think of it as a skin disease. But to tell you the truth, it's an autoimmune disease of many different types. You can have a localized scleroderma, which is skin, but there is very systemic scleroderma that affects all your organs, And what happens is, from the perspective of someone looking at a scleroderma patient, they look fabulous. Their skin looks great, okay? They look like they're carved out of stone. But it's not a good thing because they're having a buildup of collagen, something exactly opposite of what most people think. Well, we want more collagen. Yeah, you do if you don't have this autoimmune disorder. So in terms of regular traditional medicine, there's not much out there for scleroderma. And in 26 years, I've probably only seen approximately 4 scleroderma patients. And in each case, we were able to help them live longer than they were projected to and live in less pain. Because you can't imagine what an overabundance of this collagen does to your joints, etc. What happens is they freeze. You have a lot of pain. You may have pain in your GI tract, which is interesting. Why would you have it? It's loaded up with lymph nodes. Okay? There's lymph involvement in the scleroderma.
And you were telling me before the show about anti-inflammatory drugs.
Yes.
What does that have to do with this?
Well,
and talk about what you do.
Right. And this is interesting. So the traditional treatments start with anti-inflammatories. Well, okay, that's supposed to decrease skin thickening and relieve muscle pain and weakness. Well, don't you think I have a whole anti-inflammatory hydration protocol?
Absolutely.
Of course. It does include your friend vitamin C.
Yes.
Okay. But there are many other things in there. Also, they use things like vasodilators, which are like calcium channel blockers. So what happens there, it opens up the narrow blood vessels and improves circulation. Do we have a hydration protocol for that? You bet. You bet. And so we can help in that area. Proton pump inhibitors, what that's doing is it improves the swallowing and decreases the abdominal pain. Do I have something like that? You bet. We use physiological re-regulating types of subclinical doses of pharmaceuticals. And one in particular, everybody knows that I'm out there talking LDN up. It's a great product, and it's something we use. And, of course, physical therapy. They always prescribe the physical therapy. And what is that? That's the lymphatic massage. The lymphatic massage. So here we go. That's what traditionalists offer. What we can offer is the hydration therapy, which of course will improve their fluid balance. We use the homeopathics. We use things like red clover. We use probiotics. Probiotics are very, very important for continuing the digestive health. We might use L-carnitine. We use phytoestrogens. Phytoestrogens mean they are plant-sourced estrogen. This is for women, obviously. And by the way, this disease affects more women than men. We can use glucosamine and we can use chondroitin. And all of these things are done within the framework of a hydration protocol.
So the point here is that you have to keep the lymphatic system.
You got to keep the immune system and the lymphatic system.
That's related to that.
And you bet it's a very important piece. Without it, you have a backup of everything. And then you have the cellular waste that isn't leaving your body. And that contributes to more of the swelling and more of the fact that these people become stiff like stone. So here's the thing. Now, what I found very interesting, John, and maybe we should talk about this on the next segment, or
okay.
You want to go into it now?
Yeah, well, we're coming up on a break shortly.
Okay.
My question is, with the lymphatic system,
yes,
how does a patient know that it's compromised or there's an issue or a problem?
Well, hello, you have swollen glands?
Yeah, okay.
You got a problem.
Okay.
That's when the problem...
That's the number one thing?
Well, that's the one that brings you usually in to see the doc, right?
Yeah.
But really, at that point, you really have a problem. You probably have a problem already brewing. And anybody that has autoimmune cancer, all of these immune systems, if you've had a virus, if you've had a bacterial infection, if you've had dental work, and some of the dental work, like they went down to the root canal, heavy metals can cause a lymphatic dysregulation. There are so many things. It would be good not to get to the swelling and come on in and let us find out, particularly if you have a condition.
All right, we have more to talk about on that, plus other things. We're at the halfway point of the show. It's Health Watch, Sundays 8 till 9. Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates in Marlton, New Jersey. Our number here in the studio, 855-839-1210. As I said, we're at the halfway point of the show. You still have plenty of time to call in. If you have a question or you want to run by a particular medical challenge, you want to run it by Dr. Molly, now's the time to do it, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We both come back with more Health Watch after these words. And we're back here on Health Watch. Operators are standing by right now at Innovative Medical Associates, and the number is 856-489-0505, 856-489-0505. you want to sit down with Dr. Molly Fantasia, the initial consultation is complimentary. And we talk about a lot of things here on the show, and sometimes it's difficult to kind of relate it to your own situation. Well, that's why you call and schedule the initial consultation, so you can talk about your condition with Dr. Molly, and certainly she'll have a lot of good information for you on that. So all you do is call and set it up, 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, right here on Talk Radio 1210, WPHT. Again, our number here in the studio, if you have a question for Dr. Molly, 855-839-1210. You do tell us about a lot of new things here, Dr. Molly.
Well,
and
I try.
now we're going to get MSC.
MSC, yes. MSC is a group of product that is actually extracted from umbilical cord, and from live births. And so, some people refer to them as regenerative cells. So in that, they have the growth factors, et cetera. And I've spoken about this before for all kinds of stuff. Like, for example, they're using some of that to inject for regenerative medicine in the knees and in the ankles, that kind of thing, to help an athlete or somebody, or even somebody who just is a regular guy who has an injury in his knee. As you know, I have a patient right now we'll talk about who's doing well. But why I'm saying this in reference to the scleroderma. So I found a study that's being published right now from a very large university hospital system, very well known. It's in the South, and actually they're doing a MSCs for scleroderma. So when I talk about these, in particular the cytokines and the growth factors that are in that mixture, that recipe, and they're using it for the systemic scleroderma, which means the one that I was telling you about that hardens up all the organs. This is pretty exciting because I've used these not in systemic situations. I've used them for people for post-COVID in their lungs, when their lungs were hardening up from the virus, and they had a very good outcome. So I started to put this together, and I was thinking that when this patient comes in this week, it would be something for myself and one of the docs to really put together a protocol using this MSC for this obscure disorder. But I happen to know that MSCs are being used all over the world, not necessarily in this country, because there's a lot of controversy about them. And I would tell you, though, the data is coming out more and more that this might be the real 21st century medicine.
All right. What actually, can you tell us what it is? I mean,
I really would like people to call my office
okay,
and come in to talk about it. But again, some of these cells, like them, are extracted from the bone marrow. People know about bone marrow transplants. Okay,
right.
That's bone marrow stem cells. So there are things out there that can be done. It's just that they have to be done carefully. They have to be done with a good medical team, which, of course, I have, and we have to be prepared for them. But I'm telling you, there's hope out there. I guess what I'm saying again, this patient said he's at his end of the rope. He actually told the doctor who referred her to me, I think my wife is dying.
Really?
Yes. And that, to me, is enough to move me to look at whatever else is out there. Whether I do it or not, things are out there to help this patient. And I think it's important that you don't leave any stone unturned, no matter what your challenge is, particularly the autoimmune, which scleroderma is one of them.
All right. You have often talked about homeopathic re-regulators.
Oh, my goodness, yeah. And there's a lot of them.
There's a lot of them. Can you give us a couple?
Well, I use particular ones that actually work in a system called, I use a particular system that comes out of Milan. The the theory of it comes from Milan. The Italian physicians there, I had the opportunity to work with a particular scientist there who was brilliant. And what they do is they believe these physiological re-regulating particular things like cytokines and things like certain polypeptides, they are the things that work on a microscopic or a very molecular level to re-regulate both the lymphatic system and other systems within the framework of the body. So there are many out there. It has to do with a whole list of cytokines. And again, that's pretty technical, but the bottom line, know that there are things out there that can help your functionality. And that's actually what I'm all about. We can't cure these kinds of conditions. We haven't found we don't cure anything, but we will improve your autoimmune system so that you can enjoy your life.
And you've done that many times, and a lot of people have come to you, I know, and said, and this is what you just said. Oh, I think my wife is dying. Well, how many people have come to you and said, the doctor said there's nothing they can do for me?
Listen, every day I have a cancer supportive patient who comes in and says, the doctor told me I have no hope. First thing I say is get that out of your vocabulary. There's always hope. And who's the real physician in this? And for you, it's the man upstairs. And I tell every single person, let's look at the charting. Let's see where we can improve. How many patients do I have? A wonderful patient, Vera, who's up there in age. She's 84, 85. You've seen her.
Yes.
She comes in, her kids drop her off. They say she doesn't like to miss. We work around her chemotherapy, and during that period of time, she feels better, John. She feels better and is able to get her chemo. So,
all right, we're going to go to the phones,
okay.
Dr. Molly. We'll pick that up after that. We have, looks like Joe is in Mount Airy. Joe,
Hi,
good
Joe.
morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Joe.
Good morning, John and Dr. Molly. How y'all doing this morning?
How you doing? It's
doing
good to
great.
hear from you. I know you're a believer in natural type medicine. Go ahead.
Oh, no doubt, Dr. Molly. And that's what I call to say this to you and John. I love your honesty, Dr. Molly. Like you say, you don't claim to be a miracle worker, and you give credit to where the credit is due. You like to say, through God who strengthens you. That's why you become a doctor. You are, like I say, he's the ultimate physician and stuff. Though he used man and woman to do his work for him, and I appreciate your honesty, because that's what it comes. At the end of the day, Dr. Molly and John, that's what it comes down to. He's the ultimate physician, and you do the work that he instills you to do as a physician and everything. But Dr. Molly, I just want to say this real quick. It's sad that we live in a country with American people, regardless of their color, their religion, their gender, they are just being misled. Somebody like, Fauci the other day said, the pandemic is over with now. We out of this thing. then you come back, now they come back.
I love you, Joe.
Then another news broadcast, they said it's increasing all over the country again.
That's right. That's right.
Is it this? This is why people get so confused and stuff. See, my point, Dr. Molly and John, they're just not being honest with the American people about the effectiveness of this vaccine. Because like I said, I know for a fact, and I know people don't want to hear it, but I know for a fact the vaccine caused the death of a dear friend of mine last year. I know that for a fact, because she was healthy until she even told me, and she was pro-vaccine. She said, Joe, I should never got that third shot and that booster. After her health went downhill and she died, because she was getting on me about taking the vaccine. I said, no, I'm not taking it. I said, I'm going to continue taking my ivermectin, my vitamin D3. I said, I must be doing something right, Dr. Molly Jackson. I think I tested 3 or 4 times. Each time it came back negative. So I must be doing something right.
God bless you. God bless you. Obviously, I'm going to tell you something. You're keeping that lymphatic moving, I can tell you that.
Yeah.
Right? The lymphatic is moving.
Yes, I am, Dr. Molly.
And
all I'm saying, Dr. Molly, people need to keep open mind about things. And for those that decide to take the vaccine, that's the choice you can make.
Sure.
But my point is that don't beat up on people if they have alternative ways to keep this so healthy. They shouldn't be demonized and stuff like that. Because
I agree with that.
Yeah.
I agree with
that. Dr. Molly. That's all I'm saying.
Thank
you,
you.
Joe, always a pleasure.
Always a great call.
And I have to tell you, you called a couple weeks ago, and all everybody was talking about in Dr. Molly's clinic was your call.
That's right. They were saying, man.
So you have a fan club.
Hey, Joe, they said, get in the car, come down and see us. That's what they said. They loved your philosophy. Thank you, sir.
Thanks a lot for the call, Joe. Best of luck.
Thank you. You know what, John? That is a good call, because if he thinks he's confused, he should be in the healthcare business right now.
That's right.
It's very confusing.
It is very confusing,
and it
yes.
starts everybody up, and it can be a wreck. Actually, even that alone can start your system to be in a state of stress, and therefore what happens? You go down. You end up falling victim to other viruses, other vaccines, it's just a mess. It's a mess.
I wanted to ask you, with the lymphatic system,
Sure.
and you've talked about it a lot today on the show, what's the significance of the white blood cells with this? Okay,
They're your army, brother.
Okay,
that's your army. That's your first defense mechanism. The white blood cells have the cells in them that can eradicate bacteria. It can eradicate viruses. It can help hold down inflammation. So the bottom line is the lymphatics, of course, really are important to the white blood cell production, and also helps move the white blood cell, all the waste. When the white blood cells go after these things, they actually eradicate them, and you have the remnants of those. And it's through the lymphatic system that you get rid of those remnants, which shouldn't be there because they can cause lots of problems.
So the bottom line here is, I mean, you got to pay attention to your health. You got to pay attention to your system.
Right.
And you got to take charge. And you've often said take charge.
And here's the thing. You can come in with obscure symptomatology. I have another case in point. I have a wife of a very good patient. They own a very large type of trucking business. They're very smart people. His wife was a patient of ours a long time, probably 25 years. Her father comes to us. I mean, it's a group of folks who I really respect and love. So I ran a very interesting and obscure blood panels, but I did it through the traditional laboratories, which I like, because I'm able to go back and show traditional physicians, hey, I didn't run these labs that have no CLIA license or whatever. But the bottom line was she went to a different physician who is a naturopathic doctor, and the naturopathic doctor said to her, hey, whoever ran these labs really knew what they were doing. She told me this on the phone. And I said, well, I'm glad to hear that. And what is the person doing for you? Well, they're not doing hydration, but they thought I should come back for some of it as well as what they're doing. I said, that's fine. I'll happily take you back. But the point was, when I'm doing these things, I'm looking for specific things that I can discuss with my medical directors. And then we put together a plan that's appropriate for the particular patient.
We are coming up on our final break of the morning, which means you still have time to jump in with a question here if you'd like for Dr. Molly. It's a medical challenge you want to run by her, or just a simple question. 855-839-1210, 855-839-1210. Our show is Health Watch. You'll find us here every Sunday, 8 till 9 on Talk Radio 1210 WPH.D. Again, that number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return. More of today's show after these words. And we are back here on Health Watch. Dr. Molly Fantasia can be reached during the week. In fact, you can call right now. Obviously, she's here on the radio with us. But if you want to call the operator standing by at Innovative Medical, 856-489-0505. You call that number now. You can get the operators. You can make the appointment to sit down with Dr. Molly. Or you want to call that number during the week, 856-489-0505. I suggest that you call and make that appointment because there's a lot of consultations that Dr. Molly has during the course of the week. I know you already got a busy week lined up.
I do. But listen, I try to get everybody in.
You do get everybody in. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Before we get to our caller, which we'll get to in a moment, we're talking, Dr. Molly and I, that next week is Mother's Day. Oh. And you're wondering, like, hey, what can I get Mom for Mother's Day? Dr. Molly has a full line of skincare products developed with Dr. Molly and a renowned area dermatologist, Dr. Harvey Glass. Just go on the website, innovativemedicalassociates.com, and you'll see it right there. I think it's a great Mother's Day gift, especially the eye cream, which I use every day now.
That's great. That's good. That's good, John.
All right, let's go to the phones. Murray is in Burlington. Murray, good morning. You're on Health Watch with Dr. Molly.
Hi, Murray.
Good morning.
Hi.
Good morning.
Good.
My question is, what is missing when a system cannot dissolve or break down capsules? because I take a lot of supplements, and I've found that the capsules go through me.
Yeah, I find that too. That's why I'm not big on all those, which is why hydration works so well. A lot of people can, and it's maybe not your body per se. Sometimes it's some of the fillers in the gelatinous mess in the capsule. But I would also say, I'm sure you're taking enzymes when you're taking these, dear? Are you taking any enzymes?
Yes.
Good. Okay. How are you taking those? In capsules as well? Or powder or
capsules?
Capsules. Well, that's probably not a good idea. I would probably look for some other way to do it. That's number one. But I might take more. If you're taking the capsules, I'd probably take more than what they advise on the bottle. But I would want to see which ones you're getting and whatever. The second thing is, many times, the body just can't process. It's not, usually it's the shell that's giving them the problem because it has some type of filler in it. And that's an issue. That could be the issue. That could be the issue, Mary.
Well, I have fermented turmeric blend, but that's in the powder.
You know what? This is the problem. Let me go back to this. For example, that's wonderful. Turmeric is a great anti-inflammatory. It's something that I use extensively I think many, many times people may not be getting the best brand. I know the hype out there pushes certain brands. I get it. But really, sometimes it isn't the cost of the brand. It's who's doing the manufacturing of the particular product. And I will tell you, in our facility, we don't sell any orals, very few. Let me rephrase that. I do sell some. I have for example, I have a particular kidney probiotic that I think, and I have the data to show how well that's helped people. I use, and some other, I use something called, I have a colostrum product that I like. But beyond that, we don't sell anything. But we know good brands out there. I will tell you that I would put my nurse Barbara against any nutritionist out there.
So would I.
She has really looked at, and she will really guide my patients as to how to supplement their hydration therapy. But again, Mary, the best way to get any and all of your nutrients is through IV therapy. I'm telling you, you get you're getting 100% of the particular nutrient that we give. So, I mean, I can't help you there except to tell you that generally it's in the quality of the shell.
All right, Murray.
Thank you.
Thanks a lot for the call. We
Did you ever deal with hyperimmune egg supplement supporting the immune system?
Hyperimmune egg supplement to support the immune system? Mm-hmm. I'm not familiar with that, dear. But I would happily, if you have literature, send it over to me. And it has some scientific background. I'll definitely use it.
Mary, thanks a lot for the call. And
Thank
we
you.
wish you luck with that.
I do.
All right, a couple minutes left of the show. I know we wanted to do a shout out, and this is very significant because you've often talked about, improving your quality of life. And you have a patient, Judy, who's been coming to you.
By the way, she comes down like 90 miles.
Oh, yes, I know that. And Judy's been coming for years, and I know her, and I've talked to her. And the other day she said to me, 15 years breast cancer free.
Exactly.
And that's really a significant milestone. It really
certainly is. And she's a wonderful patient. She has lymphedema. But you know what I do? I run the lymphatic drain every time she comes in. She goes for the physical therapy to get the lymphatic massage. And again, it's a question of keeping her own immune system where it is. I pray that it lasts for 99 years. But again, that's in God's hands. But I will tell you that she lives a full quality of life. She's going to Disney World this week.
She told me that.
That's right.
And real quick, your dementia patient, you have something significant about that.
Yeah, this Diane has been getting the MSC cells, and her husband purported that she seems to be more engaging. She's using sentences, short but full sentences to dialogue with him, and she's letting him know her displeasure as well as good stuff, which is positive, and she's been looking at magazines. So guess what? For us, that's a win because she completely was nonverbal when she came in. And again, that's not everybody. Look, I can't cure anything, but I'll tell you what. I've not only improved her quality of life, I've improved her husband.
That's right.
Honestly.
And he thanks you for that.
He does. He's getting in my chair this week over it.
So we point these out so that you can see that there are situations where people have been substantially helped, and that's a testament to you, Dr. Molly, and your unique protocols.
Our group.
And your group, yes.
I have the most wonderful, wonderful healers that I can think of. And another thing I want to send a shout out to Dr. Pat, one of my people. She looks like a different person.
I'll tell you what, I couldn't believe. I even said it to her.
MSCs.
Okay.
And she's doing well.
And that puts the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates, 856-489-0505. 856-489-0505. And check out the web. A lot of good information on that. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com. And don't forget, if you missed any of today's show or you heard it, you want to hear it again, we have our Health Watch replay this afternoon from 4 to 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses Jess and Lana, and our medical assistant Karen Kathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a good day and a great week and a healthy one. We'll do it all over again next Sunday. Health Watch 8 till 9 here on Talk Radio 1210 WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.